A duodenal ulcer is one of several kinds of ulcers that affect the area popularly known as the stomach, even though, technically speaking, the duodenum is actually the beginning of the small intestine. A gastric ulcer, on the other hand, is an ulcer that forms in the lining of the stomach itself. Duodenal ulcers vary in size. Small ulcers may not present any symptoms, but a large one can cause internal bleeding, known as a bleeding ulcer. In severe cases, an ulcer may cause a gastric outlet obstruction, peritonitis, which is an inflammation of the tissue that lines the abdominal wall, and even a perforation of the stomach and intestines. Typically, 1 person in 10 in the United States will experience a stomach ulcer during their lifetime. What causes a duodenal ulcer? Many people believe stress and poor diet are the primary causes of stomach ulcers, but in recent years, medical science has identified a bacteria called Helicobacter pylori, or H. pylori, as the most common factor in duodenal ulcer occurrence. However, presence of the bacteria does not cause an ulcer in every case. Certain medications, especially overuse of aspirin, ibuprofen, naproxen, or other non-steroidal anti-inflammatory drugs or NSAIDs, may also contribute to duodenal ulcer formation. The following lifestyle factors also raise your chances of getting a duodenal ulcer: alcohol abuse, cigarette or tobacco use, a family history of ulcers, or the blood type O. A rare condition known as Zollinger-Ellison syndrome may also cause duodenal ulcers. Those who have Zollinger-Ellison syndrome have a tumor in the pancreas that releases high levels of a hormone that increases stomach acid production. Duodenal ulcer symptoms. As mentioned, small duodenal ulcers may not cause any symptoms at all. However, large ulcers can cause serious bleeding. The most common symptom is pain in the abdomen. Such pain varies from one individual to another and will not occur at all in some cases. Pain may also increase or decrease after a meal. Other common symptoms include excessive or unusual belching, frequent heartburn or indigestion, nausea, pain in the chest, unusual fatigue, unusual weight loss. Call a doctor right away if you experience a rigid, hard abdomen that is tender to the touch, symptoms of shock, such as fainting, excessive sweating, or confusion, stools that look bloody or dark and tarry, vomiting that includes blood. Treating a duodenal ulcer. Currently, doctors usually treat a duodenal ulcer by prescribing medications that kill the H. pylori bacteria when it is present. Medications are also available to reduce acid levels and protect the gastrointestinal tract. This strategy allows your ulcer to heal and reduces the chance it will come back. Bleeding ulcers may require a procedure called endoscopy. This procedure features a thin, tube-like device that is inserted into the area where the ulcer is located. The tube has a heating element attached to the end, and the doctor can stop the bleeding through cauterization. It's important for someone with a duodenal ulcer to follow their doctor's recommendations carefully, otherwise the ulcer may reoccur.